then the benefit of the doubt will go to the claimant, and that could assist them in terms of getting benefits. So as likely as not that the fact is true is an important thing to keep in mind when you're thinking about whether or not someone can prove entitlement. Okay, so let's get to our first element. How do you prove a current disability? Well, obviously the veteran has to have a current diagnosis, or they have to have symptoms that could lead a doctor to making a diagnosis. That diagnosis must be documented by a competent medical professional. And by medical professional, I don't just mean a doctor. This could mean a doctor, a nurse, psychiatrist, a social worker. Anybody who has the competency to make that kind of opinion will be valid with the VA. Of course, the more specialized, the better. So if somebody has a brain injury, then it's better for them to see a neurologist, obviously, than it would be, for example, to see a social worker or a nurse or a psychiatrist. The medical professional could be either from the VA or it could be a private professional. So those VA doctors are usually going to be looking at the veteran through something called a VA CNP exam. These CMP exams are set up for the veterans, and that's where the VA or a contracted medical provider will take a look and assess the person's disability and will render a decision about whether or not they have a current condition. But advocacy tip, whenever possible, it is highly recommended that you obtain private records rather than relying on VA doctors and the VA medical system to provide you with evidence. One more thing is that in terms of proving current disability, you don't merely have to use medical evidence, although medical evidence is required. You